Thank you, Jennifer. So we're going to talk today about insurance coverage for compression supplies and how that has changed thanks to passage of the Lymphedema Treatment Act. And as Jennifer said, my name is Heather Ferguson, and I'm the founder and executive director of the Lymphedema Advocacy Group. Next slide, please. So you already heard a little bit about me in Jennifer's introduction. I have twin boys, one of whom was born with primary lymphedema. We went through a bit of ordeal getting him properly diagnosed. And when he was 7 months old, he was prescribed his first set of compression garments. And we were feeling a bit of relief, thinking that the hardest part was behind us. We now knew what he had and we knew how it was treated. And we were prepared for the lifelong management. But what we didn't expect was that his compression supplies were not going to be covered by insurance. So I was appalled to hear this, and I couldn't imagine how my son's life and health would be impacted if he didn't have access to these medical supplies. And so I made up my mind that I couldn't change the fact that he had lymphedema, but I could make it easier for him to live with by making sure he had insurance coverage for the supplies that he would need to manage this disease. And so that's what I set out to do from a very early age. And if we can go on to the next slide, I'll walk you through a little bit of history about the Lymphedema Treatment Act itself. It was first introduced into the House in 2010. 5 years later, we had a companion bill introduced into the Senate. This is not uncommon. Most legislation usually begins in the House, and it doesn't get a Senate companion bill until it's got a good bit of momentum and a strong base of support in the House. A couple years after that, our support had reached really tremendous levels. And from 2017 to 2022, it was the most supported healthcare bill in Congress, thanks to our many, many advocates contacting their own members of Congress. So at its peak, our bill had over 400 co-sponsors, topping off at 86% of Congress. So that was incredibly impressive at the time, and even more so today, to think that 86% of Congress was in agreement about the importance of this issue. So finally, all of the stars aligned in 2022, and it was passed out of committee that summer, then passed the full House in the fall, and ultimately was included in a large package of bills in December of 2022. And that's how the bill eventually became law. So the day that it passed was actually 12 years and 10 months to the day after the bill was first introduced. So it was a very long journey indeed. Next slide, please. This timeline is available on our website. I realize the text is too small for you to read here, but for anyone who is interested in more details about all of the advocacy efforts that went into the passage of this bill, you can find this graphic on our website. It also includes the year after the bill was passed, which was a very important phase when the rules were being written to implement the coverage. So this timeline spans from the time the bill was introduced in 2010 until the coverage actually began on January 1st of 2024. Next slide, please. So first, I'm just going to give an overview of what the Lymphedema Treatment Act did. It created a Medicare benefit category for the coverage of compression supplies. And that was the reason that we did not have coverage before the law was passed. The supplies, as you know, typically last on average about 6 months. So they didn't meet the longevity requirements for durable medical equipment, yet they weren't something like a single-use disposable bandage. And obviously they were not an oral medication. So they just didn't have a benefit category that they could fit into. And unlike private insurance plans, where they can interpret their benefit categories however they see fit, the Medicare program has to follow the letter of the law, not the spirit of the law. And that's why we needed congressional action to actually create a Medicare benefit category that these supplies could be covered under. So that is what the law did. And it required that the coverage would have to begin on January 1st of 2024. So we had just 1 year to implement it. And it also required that patients had to have been diagnosed with lymphedema and have a prescription for the supplies to be eligible for the coverage, and that both standard and custom fit garments would have to be included in the coverage. And it also, and this was very important, it gave the Health and Human Services Secretary the authority to add other compression treatment items to the benefit category in the future. And this is because we never wanted to be in this situation again of having to pass a federal bill if something new came onto the market that was radically different than the supplies that we have today. Next slide, please. There's a number of things that the bill did not do, however, that we've frequently been asked about. It did not make changes to any other aspect of lymphedema care. So things like therapy, surgeries, pump coverage, all of those things already exist and already have their own benefit categories where they're covered. So the LTA didn't make any changes to those aspects of coverage, which is not to say that those things are perfect. They definitely do need improvement, but the improvements to those other aspects of care don't require legislative action. Therefore, it wouldn't have been appropriate or even possible to put them into the bill. And those changes certainly can be made through regulatory action and policy changes through the same kind of advocacy that we use to pass the Lymphedema Treatment Act. So those are future things that our group hopes to address as well. Next slide, please. So, as I said, during the implementation phase, this is when the rules were written that would really dictate all of the details of the coverage. So it was very important, obviously, that the full spectrum of treatment items and supplies be part of the coverage for both the intensive and maintenance phases, as well as daytime and nighttime. We also wanted to make sure that all areas of the body received equitable coverage. So historically, limbs have received better coverage than other parts of the body. But as we know, lymphedema does occur in other parts of the body, and it's just as important that those patients receive the same coverage. So part of the implementation was also creating new and revised codes to make sure that those non-limb areas of the body received the same kind of coverage. And lastly, our other priority was that the quantity limitations would be based on sets of garments, not the number of pieces. And this was important because, as we all know, sometimes, lymphedema affects a very limited area of the body, maybe just one limb, and sometimes it's far more extensive than that. So if the quantity limits were set based on the number of pieces, this would result in some patients getting everything they needed and maybe then some, while other patients wouldn't have enough. So for example, if the quantity was 8 pieces per year, and you had breast cancer related lymphedema and all you needed to wear was one daytime sleeve, that would be amazing coverage and more than enough pieces. But if you had bilateral lymphedema and needed 2 gloves, 2 arm pieces, a chest piece, and night garments, that might not even cover one set for you. So the quantity limits based on sets was extremely important, and the sets are defined as 1 compression garment per affected body part. So next slide, please. So there are some requirements for the coverage. As I've already said, you have to be diagnosed with lymphedema. You do need a detailed prescription for all of your compression supplies that have been prescribed for you, and you're going to need clinical notes supporting the medical need for those supplies, especially if you've been prescribed a custom fit item. There needs to be justification for why a standard fit item would not work in your situation. The coverage allowances are excellent, again, and this is a result of the incredible advocacy from people all around the country. During the implementation phase, there was something called a public comment period, and initially, Medicare had proposed 2 sets of garments every 6 months and 1 set of nighttime garment per year. But many, many people participated in the public comment period to express that that was an insufficient quantity, especially given that many of these supplies have to be hand washed or cannot be put in the dryer. That those quantity limits might leave a patient without a clean and dry garment to wear. So as a result of that, the final rule stated that patients could receive 3 sets of daytime garments replaced every 6 months and 2 sets of nighttime garments replaced every year. And also very important, there's no set limit on bandaging supplies during both the intensive and maintenance phases of treatment. And that is because the amount needed can vary so greatly depending on the patient, depending on how many parts of their body are affected, depending on the severity of their condition and how long they might need to be in that intensive reduction phase before moving into a maintenance type garment. And of course, many patients continue to need bandaging supplies even in the maintenance phase. Some still bandage at night instead of using a nighttime garment. And many patients can experience a flare-up due to an infection or some other circumstance where they might need to do some temporary bandaging in order to reduce the swelling to get back into their maintenance garments. Next slide, please. So the next series of slides show you handouts that are available for free on our website. I know you can't read the information on these slides, so I'm going to give you an idea of what each one of them contains, and just know that they are available to you at any time to get from our website, and they may be useful for sharing with your healthcare providers and your garment suppliers. So the first one on the left is very general information that applies to everyone. These are the things that we've already talked through, mainly about the requirements of having a lymphedema diagnosis and a prescription, and what the quantity limitations are and the replacement frequencies. Also on this are the eligible diagnosis codes in case you are working with a physician who isn't already aware of that. And it also has a little paragraph about anticipated out-of-pocket costs. So if you are a Medicare beneficiary, these supplies are covered under your Part B, which means they are subject to the Part B annual deductible and a 20% copay. If you have any other type of insurance plan, they often follow the precedent set by Medicare, and we'll talk more about that later, but your out-of-pocket costs are going to vary, and you're going to need to contact your insurance company to get more details about that. Then this handout on the right is specifically for Medicare Advantage beneficiaries. I have found over the last year that many people are not aware that there are significant differences between traditional Medicare and Medicare Advantage plans. Medicare Advantage plans do have to cover anything that Medicare does, but they do not have to do so on the same terms. They also have their own reimbursement rates, and they have their own network of suppliers. So what this means is, yes, your Medicare Advantage plan does have to cover these supplies, but they may, for example, only cover 1 set every 6 months or 2 sets every 6 months. So the frequency and the allowed amount could be different. They also have very different reimbursement rates than Medicare. They're typically much lower than Medicare, so many suppliers do not participate in network with Medicare Advantage plans. And we have heard from a significant number of patients that this has been an obstacle for them to receive their garments. So this document outlines your rights as a Medicare Advantage customer. And one of those being, if your plan does not have an in-network supplier for the items that you have been prescribed, your plan must, by law, cover an out-of-network supplier at the in-network rate without any penalty or added fee to the patient. And it also has other information here on how to appeal if you're not getting the coverage that you are entitled to under the new law. So if you are a Medicare Advantage plan customer having difficulty obtaining your compression garments since the LTA went into effect on January 1st, 2024, this document has very important information for you. Next slide, please. This next handout is specifically for patients. So there's a series of handouts. The next 3 slides, there's one for patients, one for suppliers, and one for providers. The front side is the same information on each one because it's information that all 3 of those entities need. And this, again, is information that we've already covered. It's the need for a prescription, the need for a diagnosis, the quantity limits, the replacement frequencies, and the eligible diagnosis codes for the coverage. But the back side of each of these handouts is unique to each audience that it's written for. So on this patient one, it talks about what your out-of-pocket costs will be. So that's a lot of what I just covered. In addition, it has, if you are a Medicare beneficiary, that QR code there will take you to a directory where you can find a supplier who accepts Medicare. One very important thing to remember, that if you choose a supplier who accepts claims on assignment, that means they cannot charge you any more than the Medicare fee schedule. So if you are worried about what your out-of-pocket cost will be, that is definitely the best way to go. There are also other types of suppliers who do take Medicare, but they do not accept the claims on assignment, which means they can charge any amount in addition to the Medicare fee schedule and pass that amount on to the patient. So it can make a significant difference what supplier you choose. Then also on the back of this patient handout is information on what to do if your compression supplies are denied. And again, this handout is meant for patients who have any type of insurance, not just Medicare. So we understand that not all other types of policies have adopted the same comprehensive coverage yet, and many patients are still having to appeal denials. And it has further information about what you can do to help change that so that hopefully all plans eventually will provide the same coverage as Medicare now does. Next slide, please. So this one is the provider handout. Again, the front side is the same. The back side, the information here, first of all, on the top, it has guidance on how to diagnose lymphedema. So because in the past, these were items that patients paid for out of pocket, many people, even people who've had lymphedema for years or decades, never got an actual formal diagnosis. And some do not have a doctor that is very familiar with lymphedema. So here we've described, we have a brief paragraph about how to diagnose lymphedema, and the QR codes take them to much more detailed information, which hopefully as a whole gives them the information they need to feel confident in making that diagnosis and points them in the right direction of finding additional information should they need more. It also talks about the new codes and the reimbursement rates for the supplies and what kind of details need to be included in the prescription, because the prescription has to come from the doctor. And now the doctor will usually take guidance from your lymphedema therapist, who will be the one who actually recommends exactly what type of garment you need. But the prescription itself needs to come from a physician because therapists are not eligible to write prescriptions. And so we've included here an example of a prescription that has the necessary level of detail and one that is insufficient to really help ensure that they are able to provide the patient with exactly what they need to get the supplies that they're prescribed and be covered for them. Next handout, please, or next slide, please. And lastly, this is the supplier handout. A lot of the information on the back here is the same as for the provider one. It does have those examples of the level of detail that needs to be on the prescription. So if a supplier receives a prescription from a physician, they will know, yes, this is sufficient and we should go ahead and place this order and bill the insurance, or no, we know that there is not enough information here and we should go back and try to obtain those things from the doctor first to make sure that the items are not denied. And it also has information there about the codes and the reimbursement rates. And the unique piece of information on the back here is if a supplier would like to become a Medicare participating supplier, but they're not already, it has information and a QR code there that will take them to the Medicare website so they can get enrolled to become an in-network supplier. All righty, next slide, please. So we've accomplished a ton and come a long way, but we know that there is still more work to do. First and foremost, we want to make sure that the Medicare coverage continues to be the best that it possibly can be. And that means, possibly making annual revisions to the policy. So for example, one thing that we've already done from last year to this year is get a few more codes added to the coverage for items that needed a specific code to make sure that they were going to be covered. So things like that and any other changes that we might see are necessary along the way, we will continue to make sure that the Medicare coverage is as good as it can be. Then, of course, trying to ensure that private insurance plans and all of the other public health plans follow the Medicare precedent and provide that same level of comprehensive coverage. That's something that we're going to be working very hard on this year. Last year, it was kind of the transition year where all of these other plans would have just become aware of the Medicare changes. So this year is the year that we hope to really apply pressure to those who have not adopted them of their own accord to improve their coverage. And sometimes coverage doesn't immediately equate to accessibility. For example, it's become apparent that there is an insufficient number of compression garment suppliers, especially ones that take insurance now that more patients are able to get their garments and use their insurance benefits. We also will continue to support future advancements in care with the goal being that lymphedema treatment is equivalent to that of any other chronic disease. So that has come a long way in my son's lifetime, but we are certainly not there yet. And continue to empower patients to advocate for their rights and needs. We would not have been able to accomplish this without the thousands of patients who year after year spoke up and used their voice, had the courage to share their personal stories about why this was important so we could eventually get the Lymphedema Treatment Act passed. So it is a long journey to making these big changes, but very worth it. And I'm very grateful for everyone who has supported our efforts and continues to do so. Next slide. So in a moment, we're going to start answering your questions, but I encourage you to visit our website. If you have questions, there's a lot more information there. Again, all of these handouts, as well as other things, are available. You can download them for free from our website, and you are welcome to question me or contact me with any questions. My email address is there. But if you use the contact form on our website, know that those emails do come directly to me as well. And with that, my prepared presentation is complete, and I am happy to move on to answering whatever questions have been put in the chat.
Yes, we have a number of questions here. Thank you so much, Heather, for that amazing presentation. Helps to break it down and understand it a little bit better, especially a complicated bill such as this. Okay, first question. Having a terrible time getting custom-made compression garments through online DMEs. Current wait is 7 months and counting. Seems like DME providers are not equipped to handle lymphedema patient needs. Is Medicare aware of this deficiency, and can they be made aware, and if so, how?
Okay, there's lots of parts to that.
There is.
First of all, as I already said, there is an insufficient number of suppliers, and there was especially an insufficient number of suppliers ready to accept Medicare orders at the start of last year. And those who were therefore inundated with orders because people were unable to use the supplier that they had previously, or they didn't want to because they couldn't utilize their new insurance benefits. So they were looking to a new supplier who could bill their insurance. And we are still not out of that backlog, to be honest. It's improving, but we still haven't even caught up from that backlog. And there are more suppliers starting to sell compression garments and take insurance, but not nearly as many as we need. So I certainly cannot say how long this dilemma will exist, but it is the nature of a lot more people being able to afford to order their compression garments now, which is, of course, a good thing. But the supply just hasn't caught up with the demand yet. CMS cannot force a supplier to sell any item, so this is not within their jurisdiction to be able to fix, unfortunately. But if you live in an area that has a DME supplier that does not sell compression and you are experiencing this difficulty, I would encourage you to go into their shop and say, look, these things are covered by insurance now. Maybe you didn't sell them in the past because they weren't, but they are now, and there's a lot of people that need them. And please, why don't you consider carrying them? And maybe that's one way that people can actually help to alleviate this situation right now. Were there any other parts to that question that I didn't get to?
Nope, I think you answered it. I
Okay.
just I just want to make a quick comment for those of you that are putting questions in the chat. I will not be able to read those, so if you can put them into the Q&A section, then your questions will be more likely answered. A quick question actually is a follow-up to you, Heather, about that. Do you know what the statistics are for how many people have Medicare? Because, I mean, I would imagine, millions of Americans plus, combined with the millions of people that suffer from lymphedema, just to put that into perspective regarding that question.
Yes. So during our time of advocating for the bill, it was very important that we would be able to give congressional offices an estimate. And the estimate was that there are at least 1.5 million Medicare beneficiaries, and probably that many more not yet on Medicare. So the estimate we used was 3 to 5 million Americans with lymphedema. And I know there's other groups that use an even higher estimated number. And of course, it's unfortunate that we actually don't know exactly how many. So 3 to 5 million is probably a conservative estimate, but that's a lot of people. That's a lot of people for considering the number of suppliers we have. And I would encourage you to, I know it's a very frustrating situation. My son has to wait for his custom garments as well, but don't take it out on the suppliers who are the ones taking insurance, trying to get you what you need. As I said, they've been inundated with orders because many other suppliers weren't ready to take insurance and still aren't taking insurance. So we should be thankful for the ones that are.
Yeah, so I believe you talked about this next question in your presentation, but maybe you can reiterate. This person is saying they're having a problem finding a vendor who is a network with UHC Medicare, and UHC patients are being told that they're not covered under their plan, and as including custom garments. What is your?
Yes, we received a lot of reports of problems with United Healthcare in particular. So if this is a Medicare Advantage UHC plan, you have all of the rights that I was describing on that Medicare Advantage handout. So I would encourage you to get that, bring that to your doctor, bring that to your supplier, show that to everyone, who's part of your healthcare team. Unfortunately, if it is not a Medicare Advantage plan, the LTA cannot require private policies to provide the same coverage. But the good news is, in most cases, plans willingly do eventually adopt the same coverage as Medicare because it becomes too much of an administrative burden for them to have codes covered under some plans and not others. So it will take time, but it will improve. And we need to not just sit around and wait for it to happen. We can hasten it through the same type of advocacy that we did to pass the LTA. And there is information about that on our website and about that on the backside of the patient handout. So really, how much leverage you have right now with your UHC plan depends on if it's a Medicare Advantage plan or not. And you do have a lot of leverage if it's a Medicare Advantage plan. And if it is, please do use the denial reporting form on our website because we are tracking that. And that is something that Medicare actually can assist us with. If there is a particular company or a particular plan that continues to not comply with the new law, that is something that they can actually intervene on, and that's why it's important information for us to have. So if you are a Medicare Advantage beneficiary, please do use the denial reporting form on our website.
This is about scripts. So if a person has been a long time user, can the PA gather information on needs and previous supplies and send it to the doctor for the full script?
I believe the answer is yes. I'm not a clinician myself, but I believe that the answer is yes. And just since you mentioned prescriptions as part of this, I've received several questions about how recent does the prescription need to be. Typically, with insurance for coverage for anything, the prescription has to be within the last year. This isn't true just for lymphedema supplies, but anything. And so if you had a prescription from last year or 10 years ago when you were first diagnosed, that's definitely not going to be sufficient. And that is for the patient's protection, especially in the case of lymphedema, where we know circumstances can change, swelling can go up and down, and weight gain and weight loss. An outdated prescription may not be appropriate for you at all anymore. So it is important to have a current prescription, and insurance requirements generally mean it has to be within the last 12 months.
What do you do when you find a great vendor, but they won't work with the patient because the insurance reimbursement is poor?
Well, again, unfortunately, no supplier can be forced by Medicare or by an insurance company or by the patient to accept insurance. I would still appeal to them. And, some might be able to be convinced that just out of the best interest for patients to do it. But, if the reimbursement is so poor that they're taking a loss, that's a tough pill to swallow for them. But again, if you are a Medicare Advantage patient and there is no in-network supplier, then you would have some leverage to possibly require your plan to cover at the in-network rate. But yeah, there's not really anything anyone can do to force a supplier to take an insurance plan.
Okay. Does the vendor also need a prescription from a physician for bandaging supplies?
Yes. Yes.
Okay. What about getting proper codes for Medicaid plans? They are still not covering garments, and this is what the question is.
Codes from? Well, I mean, certainly the Medicaid coverage is not universal yet. In fact, this is something that our group is working on right now, one of our priorities for this year. So we've actually just looked up all of the coverage in the different states, and it varies greatly depending on the state. So because the Medicaid program is partially funded through federal dollars, they do have more incentive than a private insurance company to follow the precedent set by the Medicare program. So that's why we're looking at that as like the next tier to hopefully improve the coverage across the board. But the LTA doesn't make any mandated coverage for the Medicaid program. So it didn't automatically improve anyone's Medicaid coverage, but I will add a note that if you are a dual eligible patient, meaning you have Medicare and Medicaid, your Medicare pays first. So you are going to be getting your coverage through your Medicare. And then if your Medicaid happened to cover anything more, then that would kick in after that. So those dual eligible patients are directly benefiting from the LTA. But if you just have Medicaid, it does not require them to do any of this coverage.
This is another UHC question. If a vendor won't invoice UHC with the correct diagnosis code, can the vendor bill me?
Well, I don't know why any vendor would intentionally not use the correct diagnosis code. So that sounds suspicious to me to start with, that there's some kind of disconnect here, because it would be in the vendor's best interest for the claim to be accepted and paid. And if they don't want it to be, so we're intentionally using the wrong code, that just doesn't sound right to me. So that if that is truly the circumstance, maybe the patient should seek out another vendor.
Yeah, I was going to say, and even go back to your clinician and ask them, have a conversation with them regarding the diagnosis code, because I know that a lot of that information comes from clinicians and or physicians and doctors. So
Right. If there's a general misunderstanding or miscommunication, try to sort that out first.
mm. If someone wants to buy Circade leg garments through Amazon, how does one obtain reimbursement? Or should the supply only be sought through a medical supplier?
If you want to submit it for insurance coverage, you have to get it through a supplier. You're not going to be reimbursed for anything you buy off of Amazon or any non-medical supplier. Just as if you, I mean, you can't, hopefully, I think, buy a prescription medication off Amazon or on the black market or wherever, but you wouldn't be able to submit that for reimbursement for your insurance. And so the same is true here.
Yeah. My patients are having difficulties getting medical records with diagnosis since they were referred by the therapist. Will therapy notes be sufficient with a doctor's prescription?
I believe that they should be, yes, as long as the prescription that actually comes from the doctor is detailed enough. Like the prescription has to be specific about the type of product, and then the clinical notes from the therapist would support the reason why they need that product. So the two would work in tandem.
Uh, so this is actually a question that's related to some news lately. If garments are imported, will they be subject to changes in tariffs?
I
No,
do not know.
that's a good question. Um, okay, let's see. It looks like I am trying to pull a handout. Oh, pull the handout for my patient who has recently received a denial. When I try to access the website, I receive a warning urging me to go back. It looks like there's some uh, a firewall or something that maybe is preventing them from getting this information. Is there another way to get that information? Can they contact your site to have it sent as a printed form?
Yes, if my suspicion is that this person is trying to do it from work and their work computer or network has some kind of firewall about what outside sites they can access, especially if they're trying to download something. So yes, they can email me and I can just attach it as a PDF for them.
Great. What is an example of sets of garments?
Okay, so I'll use my son as an example. He wears two knee highs and two sets of toe caps during the day. So for him, a set is 4 garments, a knee high for each leg and a toe cap for each foot. So for him, that is 1 set. So he would be eligible for 3 sets of garments. So that means 6 total knee highs, 1 for each leg, and 6 total toe caps, 1 for, each foot every 6 months. And if he doesn't wear a night garment, but if he did, he would be eligible for 2 sets every 2 years.
I think there's some confusion in regards to ready-to-wear garments and how they come in pairs.
Yeah.
Could
So
you
the manufacturers have actually had to repackage them for insurance purposes because a pair is different than a set. Because in the past, you might get a pair, even if they're standard fit, because they don't have a right and a left, even if you only needed them, say, for one leg, or um, but they must be sold individually now for insurance purposes to make sure that the sets are being calculated accurately.
okay. Patients under home health, are garments still covered and billable if the patient is under home health?
Yes, and that's an excellent question because that is how it was when the coverage went into effect January of last year. And then at some point during last year, Medicare actually put out a proposed rule that for situations like home health, lymphedema supplies were going to be part of the bundled payment that these agencies receive. That would have been very detrimental because we already have an insufficient number of home health agencies willing to provide lymphedema care. And they certainly couldn't afford to absorb the cost of all the lymphedema supplies because in some cases they might be nominal if it's just bandages, in others it could be thousands and thousands of dollars. So Medicare did rescind that before it ever went into effect. So lymphedema supplies will continue to be able to be billed separately under Part B, whether the patient is in home health or some other kind of circumstance.
Great. I have been managing my right arm lymphedema for 10 years after twice going through treatment. Do I get the prescription from my previous lymphedema clinic or my current oncologist? And do I have to go back in current lymphedema treatment for the prescription to be ordered filled?
Okay. So assuming that the lymphedema clinic is only therapists, no, they are not eligible to write the prescription. So she would have to get that from a physician. It doesn't have to be her previous oncologist. It could even be her primary care physician. Any doctor is eligible to write a prescription. So whatever one, honestly, that she's seeing currently is probably the most appropriate. There is no requirement in the law that a patient has to go recently been through an intensive phase of treatment to be eligible for the coverage. So the only reason she would need to do that is if she truly does need to be reduced, and it would be in her best interest to go through another intensive phase of treatment before getting her garments. Because otherwise she may get garments and the garments themselves may provide some reduction. And then in a short time, the garments may not fit properly, and that's going to be worse then. So it really just depends on how well she has maintained her reduction in her swelling, whether or not she should go through another phase of treatment before ordering her garments.
I guess a follow-up question for that, as from a clinician point of view, is, regarding the notes, the documentation that has to go with that. We know that most doctors, may know to write the script, but they may not know what to write for the documentation. So in that scenario, what would be your recommendation?
Well, in that case, it would be very valuable if she did go back to the therapist, even if it's not for a full course of reduction, even just 1 or 2 visits, so the therapist can provide current clinical notes to go along with the prescription. That might actually be necessary if the doctor is not knowledgeable enough to provide the level of detail on his own or her own. So yeah, I think that's a great idea.
Yeah, I usually do that as a clinician myself. I'll say, even though your garment might be working great, just come in, we'll do one visit, we'll see how everything's working. If it's great, if it's all the same, fantastic, we'll get you new garments. But if not, you have that chance then to be able to catch something before it becomes maybe uncontrollable or the swelling is posing an issue. So,
Exactly, because your garments are an investment. Even with coverage, they're not free. There's still deductibles and copays to be met, and much better to have a therapy visit or two and make sure you're getting what's appropriate for you now than risk purchasing those garments and they're not really right for you.
right. Um, it says, I need clarification on number of custom night garments for arm lymphedema. I was told two every 2 years, but believe you said two per year.
No, it's 2 every 2 years. So the patient could choose if they want to get them both at once, and then they're not going to be eligible for another one for another 2 years. Are they going to buy one this year and one next year? Usually with any custom item, as you know, you order one, make sure it fits properly before ordering the second one anyways. But yes, it's up to the patient if how they would want to spread those out, but it's 2 every 2 years total.
This person says, I need both socks, capris, and gloves at the same time. Why can't I order them all at once?
They should be able to, and if the supplier is saying they can't, I think that's an issue with the supplier. There's no reason those couldn't be ordered at once. Those are not even overlapping body parts. So they would be considered a set and should be purchasable all at the same time.
Someone is asking about the handouts, and I'm just going to say that you can find all the handouts on the website, and it has been posted in the chat. And but I will be sending out a follow-up email to this webinar with the link in it as well. So we will get that out to you.
And I'll just add, if you're having trouble navigating on the website where you can find them, the resources tab along the top has a drop-down menu, and they are under educational materials. So everything that you saw today is there. And some of them are also repeated underneath the insurance tab, which also has a drop-down menu. And the very last option is patient, provider, and supplier handouts. So that's where you can find those items on our website.
Great. What advocacy actions are available now?
Okay, so if you have an insurance plan other than traditional Medicare, it's probably not perfect. And so there is an advocacy page on our website now with like a sample letter and instructions for how you can contact your insurance company to encourage them to improve their coverage. So that's one action. We are also collecting patient stories, which we've always done for many years, and they were a very powerful tool in getting the Lymphedema Treatment Act passed. But one of our future goals is getting coverage for prescription shoes for patients who cannot wear any kind of standard fit shoe. So this doesn't mean if you have to buy a 10 for one foot and an 8 for another foot, that's impractical and expensive, but it's doable. But this is for patients who truly can't fit anything on their feet that can be bought through a retail source. So we already have coverage for diabetic shoes in certain circumstances, so it would be similar to that. This is a long-range goal. Hopefully it's not going to take 13 years like the LTA, but we are gearing up to make that effort. And the first step of that is collecting patient stories that support the need for custom prescription shoes for certain patients. So if you are a patient in this situation, or if you are a clinician with patients in this situation, we'd love to have your stories, and you can submit those through our story submission form.
Great. Well, we can post that on our patient resources page as well. This is about the dates, I believe, for the garments replacement. Is 6 months defined as the exact date, for example, April 15th and October 15th, or just the month?
The exact date, and it would be the date that you receive it, not the date that the order is placed, which is very important, especially because there can be quite a gap between those two. I will also say regarding this that when the coverage rules were written, the intent or assumption was that people would get all of their sets of garments in close proximity. Like standard fit, you might be literally getting them all at once. Custom, you order the first one, make sure it fits, and then order the other ones. Some people have chosen to spread it out, whether that be for financial reasons, perhaps to spread out their copay portion or whatever. But I have heard from some patients who've gotten one, then another one 2 months later, and another one 2 months after that, for example. And then they want to know, okay, when am I actually eligible again? When does the clock start over for 6 months? So this is not a written rule because as I said, Medicare was under the assumption people would just want to get them all in close proximity. So this has not been put into writing, but what I have heard from the patients who have been through this process is that Medicare seems to be handling it, that the clock starts over once you hit 6 months from your well, so it's not going to start over. So if you ordered one, like I said, uh, one, then another one 2 months later, then another one 2 months after that, you would be eligible to order one more set of garments as soon as you hit 6 months to the day from the time that you received that first set of garments. Then you can order your next one 6 months from the day from the time you received that second one. And then the third one can be ordered 6 months from the day from the time you receive the third one. This can get very complicated if you do this on an ongoing basis. So patients might be rethinking this, but that's how they've been handling it so far. So generally, to describe it in a very like umbrella way, you cannot get more than 3 sets within a 6 month window. And the clock starts to reset from the time from the time that you've actually received that first garment. Did that make sense?
Yes, yes.
Okay.
Absolutely. This is a question for the NLN. They're asking if we are tracking how many of the patients that are needing garment program funding due to lack of coverage from Medicare benefits. I don't have the exact numbers, but our garment program, where we partner with some of the manufacturers to provide complimentary garments, and which did start out largely because of Medicare and other insurance companies that were not covering. We have seen a significant decrease in the amount of applications that are coming through, and a majority of them, which kudos to Heather and her team, and a majority of them are because of Medicaid, the state insurance, as well as some of these private insurances that are not covering garments still, or are covering some, but not everything. So we are still getting more than I would like to see. Definitely. I know Heather and her amazing team will get us there someday. But yeah, I can find those specific statistics and get them out if someone is really interested. But I want to say it's almost half of what we were seeing before, which is great. Yeah. Okay. This says there are many Medicare Advantage plans that are not complying with Medicare coverage at this time. However, the patient cannot report a denial because the patient does not have the financial means to pay for the garments to receive them. The garments must have been provided to allow for the billing of claim. What can such patients do?
Yes, that is a very frustrating situation because ideally you would have that written denial in hand, and that is your proof that they didn't cover it. But I certainly understand that many people can't afford to pay out of pocket to get to that point. I would encourage you to document everything. First of all, get as many things in writing as you can. So if you're talking to a customer agent on the phone, a customer service agent on the phone, say, can you send me this in writing? If they won't do it, make detailed notes yourself. Try to document every person you've talked to, the time, the day, exactly what they told you, so that you can build as strong of a case as possible without actually having that denial in hand. And I think that anyone reviewing this matter would certainly understand why you couldn't pay perhaps thousands of dollars out of pocket to prove that they didn't cover it.
Yeah. Okay, before my facility, an outpatient PT specializing in lymphedema applied as a DME provider, I asked a question if this can violate the Stark law. Can you please give light on this?
So I would encourage them to also reach out to the APTA or the AOTA, depending on whether it's an occupational or physical therapist, because they can be very helpful in this situation. No, if you a clinician, a therapist, a therapy clinic is totally eligible to register as a DME supplier. This is actually something that we spoke with about CMS when they were implementing the coverage, because we knew some clinics were already selling direct to patients because the patients were just, paying out of pocket. and that they would want to be able to continue to do that. And that's a great convenience for the patients who are in that situation. So they are very eligible to do that, and there's no legal concerns. Now, I know there has been some talk about the Stark Law and reimbursement for measuring and fitting services if they're providing the service, but another supplier is actually billing for the garment. That is a separate topic entirely, although one that we are also working with the APTA and the AOTA on. But the short answer is they are very eligible to become suppliers, and I encourage them to do so because it's a wonderful service to be able to provide to their patients. And there is information on our website if they don't already know how to become a DME supplier. Under that insurance tab, supplier information is one of the options on the drop-down menu. And there's a link there where suppliers can learn how to register. Or prospective suppliers, I should say, those who wish to become suppliers.
All right, we have time for maybe two more questions. Can a patient self-pay for a lymphedema garment with an authorized DME provider and then seek reimbursement from Medicare? Seems like it would be faster than waiting on the DME provider to get an order processed. How would you submit such a claim to Medicare?
They absolutely can. And I have heard that this is a workaround to kind of avoid the delays that are going on right now when the patient can afford to do so. As we've probably all experienced, it can be a little bit like a lot of legwork and time consuming to file a claim on your own, but it's certainly doable. You are eligible to do that as a Medicare beneficiary as long as you have purchased it from a Medicare participating supplier. You will be reimbursed, and the supplier, well, you would be reimbursed because you've already paid the supplier. So if you can afford to pay out of pocket, this is a way that you can kind of bypass the current backlog of orders waiting to be processed by insurance.
And just to follow up on that, I think this is something good to reiterate. This person is saying they've been waiting 7 months for a custom leg garment. She's saying if she understands correctly, it would be another 6 months from when she receives it to have Medicare pay for replacement. Seems very unfair, but I think there might be a little confusion there.
Yes. Yeah. I mean, first of all, she's eligible for 3 sets. So you're only having to wait another 6 months once you've received all 3 of your sets. Now, I understand the frustration that if it's taking this long to get your first one, you're not even going to be able to get your 3 sets during this that you're eligible for during that 6 month window. So I do sympathize with that. But it's not Medicare's fault. And unfortunately, like we've already covered, Medicare can't force more suppliers to begin selling these supplies.
Yeah. All right. Well, it is 2 o'clock and we still have loads and loads of questions, but unfortunately we cannot get to them, excuse me, all today. Please feel free to go to Heather's website. Sorry, I always want to say Lymphedema Treatment Act, but it is not, I know it has changed if you don't mind saying what the new one is.
Yes, so our new website is lymphedemaadvocacygroup.org, which I'll add was always our group's name, but because our sole priority for many, many years was the LTA, that was our previous website's address, but now we are the Lymphedema Advocacy Group, or lymphedemaadvocacygroup.org is the website.
Thank you. It just slipped my mind for a moment. But there you can submit more questions and find all of this fantastic information there on that website. You're more than welcome to email us here at the NLN at lymphnet.org. Like I said, I will be sending out a follow-up email with some of these links. And also this recording will be available probably in about a week or so, and I will send a follow-up email to let everyone know when it is ready. Again, thank you so much, Heather, for being here today. Really appreciate your time and sharing the information with the community.
Thanks for having me. It's been a
Any,
pleasure.
anytime.